Hello everyone, myself Dr. Surabhi Sahney. Today I come forward to talk about the another sets of previous year question paper of Neet Mds exam of the year 2013. So begin with the first question. Here it goes on your screen. Which of the following feature is the most important in giving a canal resistance form? Option A, apical stop. Option B, apical seat. Option C, natural anatomy. And option D, tapering of canal walls. So what do you think? What will be the right answer for this question? Right answer is option D, that is tapering the canal walls. If you taper the walls of the canal, it will give a very good resistance form. Begin with the next question. Here it goes on your screen. Which of the following is not relevant with regard to use rubber dam? Option A, latex allergy. Option B, sleep apnea. Option C, claustrophobia. And option D, sinusitis. Not relevant to use rubber dam. What do you think? What will be the right answer for this type of question? The right answer is option B, that is sleep apnea, because a rubber dam is made up of latex, so latex allergy is excluded option. Then option B is the correct answer for this type of question. Begin with the third question. Here it goes on your screen. All clasp assemblies should not have. Option A, one area of retention. Option B, two areas of retention. Option C, a guide plane. And option D, a bracing element. So what do you think? What will be the right answer for this question? Here the right answer is option B, that is the two areas of retention. Here the cast circumferential is a suprabulge clasp which engage an undercut on the tooth by originating the coronal to the height of the contour. Infrabulge clasp will engage the undercut by approaching the gingiva or gingival part. So two areas of retention is very important. Begin with the next question. Here it goes on your screen. How does glyceryl trinitrate work? Option A, analgesic action. Option B, dilates veins and reduce the preload. Option C, increases the preload to the heart by constricting veins. And option D, reduces heart rate. So what do you think? What will be the right answer for this question? The right answer is option B, that it dilates the vein and reduces the preload. Actually, the glyceryl trinitrate is given sublingually, and sublingually it is rapidly absorbed and cause the venous dilatation. In return, it will cause the venous return to the heart and therefore it reduces the preload. So that's why the option B is the right answer. Begin with the next question. Here it goes on your screen. Which one of the following cranial nerve is most likely to be affected in a patient who has lost her corneal reflex? Option A, accessory. Option B, abducent. Option C, facial. And option D, oculomotor. So what do you think? What will be the right answer for this question? The right answer for this question is option C, that is facial. Begin with the next question. Here it goes on your screen. Which one of the following statement regarding HIV in children is false? Make sure you read the question very well. Now it's asking about a false statement. So the first option is, in most cases it is due to the administration of contaminated blood products. Option B, it may present with pneumocystic pneumonia. Option C, it may present with neurological signs in the absence of immunodeficiency. Option D, it is more likely to present with recurrent bacterial infections than in adults. So what do you think? Which statement is false regarding HIV in children? Here the false statement and the right answer is option A, that in most of the cases it is due to the administration of contaminated blood product, because most of the HIV infection in children result from the mother by the vertical transmission. So begin with the next question. Here it goes on your screen. Which two drugs should be given to a patient you suspect having the myocardial infarction? Option A, aspirin and warfarin. Option B, aspirin and paracetamol. Option C, aspirin and clopidogrel. Option D, paracetamol and warfarin. What do you think? What will be the right answer for this question? The right answer for this question is option C, aspirin and clopidogrel. The correct treatment suspecting the myocardial infarction is 300 mg of aspirin and 600 mg of clopidogrel should be given. Begin with the next question. Here it goes on your screen. The basic structural unit of the nervous system is, I think this is the very easy question. Option A, neuron. Option B, osteon. Option C, sarcomere. And option D, keratinocyte. So what do you think? What will be the right answer for this question? The right answer for this question is option A, neurons, because neurons are the basic structural unit of nervous system. Begin with the next question. Here it goes on your screen. Local anesthetics produce which effect on the nerve membrane? A, less sodium is required to achieve repolarization. Option B, more sodium is required to achieve depolarization. Option C, less potassium is required to achieve depolarization. And option D, more potassium is required to achieve repolarization. Make sure you will not get confused between depolarization and repolarization while reading the options. So please read the options carefully. What do you think? What will be the right answer for this question? So here the right answer is option B. More sodium is required to achieve depolarization, because when nerve get exposed to local anesthesia, there is a firing threshold, and that's why we require more amount of sodium to elect the depolarization. So that's why option B is the right answer. Begin with the next question. Here it goes on your screen. In order to inhibit the impulse transmission in a myelinated nerve, the anesthetic solution must cover how many millimeter of nerve fiber? Option A, 1 to 2. Option B, 3 to 5. Option C, 6 to 7. And option D, 8 to 10. So what do you think? What will be the right answer for this question? Make sure you read the question carefully. Here the right answer is option D, that is 8 to 10 millimeter, because anesthetic solution will develop 8 to 10 millimeter of myelinated nerve fibers to ensure the profound anesthesia. So 8 to 10 millimeters of nerve fiber is affected. Begin with the next question. Here it goes on your screen. Which reduces the duration of anesthesia? Option A, tachyphylaxis. Option B, decreased vascularity. Option C, increased protein binding. And option D, addition of a vasopressor. So what do you think? What will be the right answer for this question? Reduces the duration of anesthesia. The right answer is option A, that is the tachyphylaxis, because tachyphylaxis will increase the re-administration of drug and definitely in return it will reduce the duration of local anesthesia. With the next question, here it goes on your screen. In the presence of tissue inflammation or infection, local anesthesia is option A, nearly twice as potent. Option B, more rapidly achieved. Option C, more difficult to achieve. And option D, likely to spread the infection. So what do you think? What will be the right answer for this question? The right answer is option C. It is more difficult to achieve, because local anesthesia is more difficult to act or to achieve anesthesia in case of infected and inflamed tissue. That's all about the another sets of previous year question paper regarding Neet MDS exam. If you still have any query, you can drop me a mail which is shown on your screen. And if you like this video, press the like button and comment down. Do share more and more my videos and stay tuned for the upcoming videos regarding the another sets of paper discussion of previous year question papers regarding Neet MDS, INSET exam, HPSC exam and so on. So thank you for watching.